Welcome everyone. My name is Ziam, and I'm thrilled to have you join us for today's exciting webinar. Your presence here reflects your dedication to excelling in your medical career, and we're honored to be part of your journey. Our mission today is simple yet powerful: to provide you with the tools, insights, and confidence needed to conquer your upcoming PLAB exam and take a significant step towards your goals. Before we begin, let me share an exclusive opportunity designed just for you. Access 5,000 of the latest PLAB MCQs for free in 3 easy steps. Number 1, visit hivemedicalacademy.com and register with your name, email address, and phone number. Then after that, what you want to do is subscribe to our YouTube channel, take a screenshot, and share it with us via WhatsApp using the number in the chat. Once we receive your details, our admin team will provide you with the login credentials to access this incredible resource. It's as simple as that, and we hope you can take advantage of this offer. Now, let's jump into today's session. I'm delighted to introduce you to our esteemed speaker, Miss Akida Javed. Akida is not only a dedicated first-year long medical student, but also passionate student ambassador for Hive Medical Academy. She brings first-hand experience and invaluable insights about the challenges, concerns, and worries that international medical graduates face during the PLAB journey. Today, Akida will guide us through these hurdles and share practical solutions to help you succeed. And don't forget, we'll conclude this with a Q&A session, so feel free to jot anything down as we proceed with the session. Without further ado, let's dive in and make the session a game changer for your journey ahead.
Hello, everyone. Thank you so much, Ziam, for such a good introduction. So I am Akita Javed, and I'm an IMG, International Medical Graduate. So I'm going to share with you guys my personal concerns and worries, which I had before coming to know about Hive, that the things which were bothering me. One was like fear of failure and high-stake nature of the exam. Yes, when you put time into something, like I decided to give PLAB examination. So my major concern was that I'm going to put so much time into it. I'm going to put so much money into it. I'm going to give exam fees. I'm going to cover up the travel costs, and I'm going to go and give the money for settling into the UK and everything. So I'm going to put so much money. I'm going to put so much time of mine. And at the end of the day, what if I fail? What if I don't get, I'm not able to adjust to the UK medical system or culture? So my concerns were like, firstly, I had these concerns. Then my concerns were like, when should I apply? Okay, fine. I decided to give PLAB examination just like you guys. Right now, you guys are attending the Hive Medical Academy. So you guys really want to give the PLAB examination, right? So everyone comment down from which area are you attending this webinar from, so that I can get relate to you that like from which area of the country you are talking to. Can you comment down, everyone? Chat box is open. Because if you guys are from Pakistan or you're from India, from South Asian region, you guys know that there is a high saturation of jobs that is going on in these areas. And despite of clearing and having the medical degree, we are not able to, yes, India and many, everyone, I'm asking everyone, I know. India, I know saturation of job is there. And even after getting the medical degree, we are not able to get the paid amount of job, like not high amount of payment is going to be given to us. So we all opting for UK examination, right? So UK, so when I was adapting and I was planning to go to UK and give PLAB examination, my one basic concern was, when should I apply? Dates. Examination dates are very important to know. And on internet, there were like different dates that were coming down, and there were like different data that was being placed that you could apply from this website, you can apply from this website, like different websites were there. And I didn't know which website is actually authentic and which I should apply. My next was like, what resources should I follow? Because like medical knowledge is too vast. Like there is Guyton and Hall for physiology, there is Robbins for pathology, and these books are too much detailed. We cannot note down the questions for international examination from these books. We need specific books. There is this thing that smart work over hard work, right? So for MCQs thing, I was concerned like where should I go and from which Q bank should I follow? So I was confused. Like I wanted to do PLAB examination, but I didn't knew which path to follow. Like if you're going to a destination, you're planning to go on a holiday, you must know, you will turn on your GPS, right? So for me, my GPS turned out to be the Hive Medical Academy, because Hive Medical Academy told me that, okay, fine, you want to give the PLAB examination, don't worry about anything else. You don't need to worry about your dates. You don't need to worry about from which source you need to study. You don't need to worry about whether should I think about where should I go and live in UK if I am giving the PLAB examination. Obviously, the person who gives the PLAB 1 have to give the PLAB 2, right? So what's the point of giving PLAB1 when you're not planning to give the PLAB2? So for PLAB2 examination, you have to go to UK and you have to go and practically give that examination, right? So PLAB2 journey, when I was thinking of going to UK and like having my PLAB2 journey, my basic concern again raised was, okay, fine, I will give the PLAB2. If my PLAB1 even get cleared, then I want to give the PLAB2. For PLAB2, I need to get visa done. I need to get my tickets done. And then even after getting a visa done, where would I live? I don't know anyone there. And in India and Pakistan, I know many of us don't have anyone in UK to be there for us to tell us that yes, we are here. All you need to do is worry for your exam. You don't need to think about anything else about your accommodation. You don't need to think about your exam timings or everything. You don't need to worry that in which part of the UK my center is going to be and I'm going to give that examination in that center. You don't have that information, right? So one stop journey, when I will say, is Hive. Hive told me that you don't need to worry about anything. All you need to do is that register to our academy. Then you can, everything will be done by us. We will inform you about dates. We will do your registration process. We will give your examination details as well. We will provide you with Q-banks and everything. We will give you the best resources to study. And we will also give you the visa and everything else. So like everything got sorted for me by Hive Medical Academy. Now I am relaxed and chill that all I need to do is focus on my preparation and I don't need to focus on anything else. My preparation, if it is at best level, then I could reach the UK easily and I can be a doctor there. So my journey went from a zigzag zoo to a clear destination through Hive Medical Academy. One thing is this, and next thing I know many of you will be concerned that, okay, Hive is according to you one-stop solution. Got it. Then how you would check the authenticity of the Hive Medical Academy, because you're going to put your money inside something, right? So when that concern came to me, I was like, let's go and Google hivemedicalacademy.com. And I was shocked to see that Hive Medical Academy is working since 2013. It is not into being right now. It is working since 2013. And then I checked the results of hivemedicalacademy.com and I got shocked that this academy, I was not known about it, but this academy has graduated more than 8,000 medical students and have made their journey possible till UK. Now students of Hive, 8,000 students of Hive Medical Academy are in UK. And then I went to the interviews and everything. So that was my way of checking whether Hive is the right destination for me or not. You can also do the same thing, go to their website, check their details, get satisfied from them, and then only proceed. But for me, like you said, there is one thing, that destination is in your mind, everything is in your mind, but you don't know the way. You need to have a GPS, you need to know the location, you need to know the ways through which you're going to travel and you are going to reach your destination. So either do it from an academy, because academy will leave out all your worries. You just need to worry about your exam, prepare for your exam, because medical exam are not that easy. You have to study for it, you have to work hard for it. There are different types of questions, there are different angles of question. If you're expecting that just like examination in India and Pakistan, there are going to be one liners and everything, it is not in when it comes to PLAB examinations are not one liner questions, right? So you need to have guidance of some big person, a person who knows better than you. So Hive Medical Academy have got all the instructors who are going to guide you the way it is really needed for you. So that was my concern, and these were the obstacles that I feel I was going to have, and it got addressed by hivemedicalacademy.com. So I would feel if you are planning for PLAB examination, one thing you should do is at least go and talk to Hive Medical and get yourself satisfied with it, because I have got my satisfaction from Hive. When I'm saying as an IMG that I did got satisfied, then I'm sure the 100% like maximum of you will get satisfied. So thank you so much for giving me an opportunity, Hive Medical Academy, to share my experience and worries with everyone. Now let's get started. And before I proceed, any one of you who want to convey anything regarding that, if you guys if you guys can relate to me with my concerns, you can just type yes in the chat box below and can tell me that yes, we do face these challenges: visa, tickets, accommodation, then how to book an exam, how to clear the dates, how to know from which date is our examination is going to be. These concerns, if you are facing the same concerns, then just write yes in the chat box below. And I'm taking so much time, and I know many of you are waiting for Dr. Umar, because Dr. Umar is expert, and he is the one person in Hive Medical Academy who you really need to have insight from about examination system and everything. So I will not make you wait any further. And I'm thrilled to introduce you all to Dr. Umar. Dr. Umar was a general practitioner in NHS for 10 years, and he has held various lecturing, examining, and clinical educational supervision roles for medical students. That's what I'm saying. That like Hive Medical Academy has got all you need. Like he has got so much knowledge that if you do talk to him and you do listen to him properly, everything you need to know about PLAB will be done. And he has also trained general practitioner for several years. So, Dr. Umar, the floor is all yours, and everyone is waiting for you, and they are thrilled to talk to you, and they're thrilled to listen to you. Thank you so much, Dr. Umar.
Thank you, Akida. Thank you for such a kind introduction. Thank you, Ziam, everyone at Hive, and thank you to everyone for joining today. Please confirm anybody that I'm audible and that my screen is now shared and you can see the PowerPoint slide. Anyone please confirm? Okay, great. Thank you very much. So welcome everybody. It's fantastic to be doing another webinar again. Thank you so much for giving up your time to come and have a listen to our team, how we can help you. And in particular, obviously today we're focusing on exam hacks, so exam techniques, study techniques. In the future, we're going to be doing more webinars to cover things like the IMG journey and the concerns that Akidat has just mentioned. And so hopefully, there's more to come from that side of things. But today we're going to focus on the PLAB1 exam specifically. So hopefully you'll find it useful. We're going to just first of all going to touch on some study tips. Then we're going to discuss some tips for how to approach MCQs, and then we're going to go into the actual discussion of some sample questions. I really do need everyone to participate, particularly in the exam, in the part where we discuss the questions. Please drop your answers in the chat box. It really helps the session to flow better, and it helps the teaching to kind of come out better. Other than that, please just keep yourself muted. There will be opportunity at the end to unmute yourself and ask some questions, or you can just carry on putting your questions into the chat box throughout. And remember, Ziam at the beginning very kindly has already mentioned that we do have an offer of free access to 5,000 MCQs for you to get an idea of our resources. So if you want to go ahead and take up that offer, then we'd be thrilled to help you with that. Okay, so let's start first of all with some tips on how to approach PLAB1 study. So PLAB1 is a big syllabus. I don't know how many of you have actually had a look at the GMC blueprint. Obviously, now we know that it's compliant with the UK MLA blueprint, so everything we say applies to the UK MLA as well. It's a huge syllabus. The information that's actually out there from the GMC is very vague, but obviously it just lists a whole load of conditions, a whole load of concepts and things that you need to be aware of. And what we try to focus on at Hive is this plan, study, practice, and analyze cycle. So you have to plan for this because it's such a big syllabus. There's lots of stuff that you have to cover. If you don't plan, you're not going to be able to cover anything in time or everything in time. Study, obviously, you will need to study. You will need to work hard. You will need to cover the things that perhaps you already know about and perhaps you already have covered before. But of course, the key difference when you're studying for PLAB is everything needs to be UK focused. It needs to be focused on UK guidelines, UK practice, and you might have You might be very experienced and have worked in other countries, and all that knowledge is great, but you need to make sure that it's the correct knowledge, which is appropriate for UK practice. Otherwise, you're going to struggle on the exam. Practice, obviously, is really important. You can't do well on any type of examination without practice. You need to practice with the MCQs. You need to practice with mock tests. You need to practice in a mock kind of environment and exam conditions, because it's 180 questions in 180 minutes. Time is of the essence. So practice is, of course, important. And then the final part of this 4-step cycle that we always speak about in Hive is analysis. So when you plan, it will allow you to study better. You need to practice after the studying is done, or you can do it in chunks and then practice, but you need to analyze how you're doing on the questions, identify the weak areas, and then go back and cover them again in your actual study. So that's a very, very brief overview of the kind of strategy we will help you with. Obviously, everything will be personalized when you come through Hive. There's 3 other key points that I want to highlight here as well. Learning styles are really important. This is the kind of things sometimes in some places we are aware of when we're younger. In other places, you might not be aware of until you've actually gone through all your studies and you've started working. You might not actually be aware of what your best learning style is. If you can do a learning style questionnaire, and we can even help you with that. It will help you to make sure that your learning is more efficient and your revision is more efficient. The knowledge we've already touched on. It needs to be the correct knowledge relevant to the UK. Otherwise, you're going to struggle to pass the exam. And the final thing I want to mention before moving into some tips for the MCQs is that exam technique is just as important as the planning you do, the studying you do, the practice you do, everything else. Because if you don't have good exam technique, you might have all the knowledge that is appropriate, but if you can't apply it to the exam on the day, then you are going to struggle. So the PLAB1 exam is a combination of knowledge and application of that knowledge. It's not just rote learning. It's not just memorization, which is what you might be used to. It's about applying the knowledge you have to the situations in the questions. Let's discuss very briefly now 3 key tips I always like to mention about MCQs. There's lots of other ones, and some of them will come out as we discuss some of the questions, but these are just so fundamental to ensuring that you approach the MCQ correctly. The first one is, it sounds really obvious, but what is being asked? Read the question properly. The number of times students, candidates, even happens to myself sometimes when I'm reviewing some of our questions. If you skim read something and you miss something, or you miss a negative in the question in a sentence, or you miss something else that actually changes your understanding of the question, and you proceed to go and answer the question, then obviously you're going to answer it incorrectly. So read it properly, make sure you understand what exactly is being asked. The second thing is, don't get distracted by irrelevant information in the question. There's these scenarios, and you've probably seen some examples already. We're going to discuss some in a few minutes, but there's usually a short kind of summary or a scenario or a case summary that you have to read. Sometimes there are things mentioned in there that are just put in there as information fillers. Sometimes they're just put in there as distractors. Don't get distracted by irrelevant information. You have to highlight the key points of the question, which will help you decide what the correct answer is. And obviously, if you're doing this on the computer-based exam, then you need to do this mentally. There's no other way, and you can only do this by practicing lots and lots. The final thing I want to mention about exam technique is time management. I can't overemphasize really how important this is. It's 1 minute per question. You've got 180 minutes and it's 180 questions. It's going to take you an average of a minute per question to finish that exam. So if you come across something that you're unsure of, you're struggling with, you're taking a bit too long, flag it, and then come back to it at the end. Don't spend more time on it and waste time that you could use better in further questions, which you might get much quicker. So time management is really crucial. Obviously, lots of these points are only going to come after you've done your study, after you've done some practice, and when you start doing the mock exams. We have 10 mock exams available in our top PLAB package. So that's 10 exam condition timed mock exams. By the time you've done all them, after 2, 3, 4 months of preparation, you'll really be ready to crack on and do really well in this exam. So just some very brief points. Obviously, we need to discuss some questions. If you hopefully come on board with us, we'll have much more detailed teachings, and in future webinars, we can discuss more in detail as well. But let's move on to discuss some example questions now. And we'll start with one that I think is nice and easy, nice and straightforward. At least I think it's a pretty straightforward one. I'll read out the question. I'll give you a minute or so as well to read it yourself and to just have a think, but do pop your answer in the chat box, because that really does help the session become more interactive. So, a 34-year-old male patient was admitted for severe depression and suicidal thoughts. He attempted to commit suicide. He has been on sertraline for the past year, which he had stopped a month ago. He had been admitted in the psychiatric ward 2 years ago for mania. On discharge, the patient wishes to know if he can be started on a long-term medication to alleviate his symptoms. What single medication will be most useful? And the options are amitriptyline, lithium, diazepam, haloperidol, and fluoxetine. So have a quick look at that. Have a reread yourself. Obviously, in the exam, the question is not going to be read to you. So, but it just seems a bit odd in a webinar to just be silent and let everybody read it. So I just tend to read it out. But do have a look at that. Have a think. Drop your answer in the chat box, please. Everyone, please participate. That will be really helpful to get an idea of what everybody's thinking. And then, of course, we'll have a chat about the right answer and what the learning points are from this question. Okay, thank you. So somebody's already put in D. Thank you for that. Everybody else, please do drop in your answers. Okay, fantastic. What about everybody else? Please participate. Even the guys from the team. Let's get everybody having a go. Okay. A couple of answers for D, one for C. Any others? Last chance. Okay. Right. Thank you for dropping your answers in there. So hopefully people will get a bit more comfortable as the webinar goes on. So the key points I want to highlight in this question, just before we actually move on to discuss the correct answer. So obviously you've got a male patient who's admitted with severe depression and suicidal thoughts. He actually attempted to commit suicide. He's been on sertraline in the past. The most key sentence, the sentence that's most key in this question, I think, is this one here. He had been admitted in the psychiatric ward 2 years ago for mania. Now, if you miss this, or you don't notice this, or you don't register it mentally, what you will actually think is that you've got somebody who's essentially severely depressed. They're having suicidal thoughts, and you might be kind of attracted towards perhaps one of the antidepressants. So we did have a couple of suggestions for haloperidol as well, but this is actually a patient who is clearly cycling between depression and mania. It's made clear in the question. So this means that this patient is likely suffering from bipolar disorder, and which medication is most appropriate for bipolar disorder from these options? It's B, lithium. So as I said, that middle sentence is absolutely key, and this is the kind of thing you need to get good at, is just making sure you are able to read all the information and highlight mentally what are the actual key bits and the most important parts of that scenario. So he's suffering from bipolar disorder. Long-term management requires mood stabilizers, and the only one really that's mentioned in this list of options is B, which is lithium. And this is an example of a question where really, to be honest, there's only one real possible correct answer. A lot of the time in PLAB1 questions, you get 2 or 3 that can seem sensible. Personally, I think this one only had this one as the correct answer if you read the question properly and if you understood it. So, you know, that's just a one what I thought was quite a straightforward one to start with. But obviously that exam technique is really important, ensuring that you actually read the questions properly. So hopefully you picked up something from that one. Let's move on to the next one now. This should be hopefully a bit more familiar to some of the guys who perhaps, you know, that was a psychiatric question. Your psychiatric knowledge might not be so good. This should be a bit more familiar to you guys. So a 15-year-old girl is about to be discharged from the hospital after an uncomplicated appendectomy 24 hours ago. She is experiencing mild pain at the surgical site. She is currently in the surgical ward. She has a temperature of 37.3 degrees, heart rate of 80 beats per minute. Blood pressure is 100 over 70 millimeters of mercury. Respiratory rate is 20. Oxygen saturation is 99%. And there are no signs of abdominal rigidity. What is the single most appropriate management? So the options are: take the patient back to theatre and re-explore, continue to observe, start intravenous antibiotics, administer lidocaine injections at the wound site, or discharge with analgesia. So have a reread of that, guys. If you need to just get you know, as I said, it's a bit odd to have a question read to you. So have a read of it yourself. We'll give you best part of a minute or so, and then drop your answer in the chat box. It's just useful for me to get an idea of what kind of answers people are thinking about, and then we can highlight the teaching points a bit more clearly for everybody. Okay. What do you think, guys? Drop your answers in the chat box. Don't be shy. Don't be worried. This is the place to, you know, to actually share your answers, to, you know, to actually have a go at things and you know, and get things wrong, because, you know, you'd rather do that here. You'd rather do that in your practice rather than when you're actually sitting the PLAB1 exam. So don't be shy. Drop your answers in the questions. Okay, thank you, Hafizateen. Okay, couple of answers for C. That's great. Everybody else, please drop them in there. All right. So we seem to have a bit of consensus here on C. So I'll just give you a few seconds if anybody else wants to have a go. Okay. Yeah. Everybody thinks C. Okay. Brilliant. Fantastic. Thank you. So this example question is a good demonstration of real life scenarios that you will encounter in practice. That's why the PLAB exams are really relevant. This will happen. Remember, the PLAB1 exam is set at a level for an SHO, or what in the UK is the equivalent of an FY2, so the beginning. So it's quite a junior level. So you'll be on surgical wards, you'll be managing these patients, reviewing them potentially before discharge, etc. And that is exactly what is being highlighted in this question. So the main points to notice from this scenario are this patient is about to be discharged. Okay. She has mild pain at the site. Okay. Obs are normal. Examination, there's no rigidity, so there's no signs of peritonism. In summary, she's medically stable. She has no red flags. And, so she's got a bit of pain at the site, but obviously she's just had an appendectomy 24 hours ago. That's not to be unexpected, is it? 37.3, that's not pyrexia. Her obs are okay. So actually what the scenario is painting to you, this is somebody who's pretty medically stable. There doesn't seem to be anything worrying in her observations or the examination. What is the best thing that you should, what is the most appropriate step that you should be taking? So the correct answer actually is E, discharge with analgesia. Now I can see that a majority of people or everybody answered C, which is start intravenous antibiotics. Maybe you kind of looked at she's having pain at the site. Maybe you thought temperature 37.3, is it slightly raised? It's actually not classed as a fever. Her heart rate stable, her respiratory rate is normal, her blood pressure is okay. And as I said, look, she's got no signs of abdominal rigidity. So if we actually go through each particular answer option, we can explain why it's not appropriate. So why would you need to take a patient back to theatre and re-explore when there's no red flags, obs are normal, there's no signs of complications on the examination? Okay, so we can put that one to the side. B, continue to observe. You're doing a discharge review. If there was anything concerning in what you found, let's say her obs weren't normal, she had a pyrexia, she was tachycardic, or her blood pressure was a bit low, whatever, then it would make sense to delay her discharge. So continuing to observe also isn't correct. Starting intravenous antibiotics, as I said, that's the one that most people did, possibly because they're thinking she's got some pain in the area, maybe there's a developing infection. I can understand the thinking there, but actually she's not pyrexial. It's totally normal to have mild pain at the site. She's just had a laparotomy at the end of the day. So that one also isn't correct either. Administering lidocaine injections at the wound site, that's a totally inappropriate option, really. If anything, you'd for analgesia, you'd give her some oral analgesia, some paracetamol or something a bit stronger. You wouldn't need to administer injections. So the only correct one is discharge with analgesia. So hopefully you found the discussion of that one useful, much more relevant to kind of stuff perhaps you've already done in your house jobs, etc., or wherever you've been working. So let's move on. Have a look at the next one. Okay, so I'm just going to move this because I can't actually read the full question. Okay, so Lucy is 29 years old and is 10 weeks pregnant with her first baby. She attends the GP surgery as she is struggling with nausea and vomiting for the last week. She's tried various measures such as ginger, small bland meals, and drinking fluids little and often. However, she's still finding it very hard to tolerate full meals, but is snacking during the day. She's passing urine well, despite vomiting around 5 times a day, and has been unable to work as a hairdresser as normal. There is no abdominal pain, dysuria, or fever. She's very keen to try some medication. Past medical history is unremarkable. On examination, her observations are normal, and the urine dip shows no evidence of white cells, nitrites, blood, protein, or ketones. Which one is the best management option? So the options are: advise assessment in the early pregnancy unit, initiate ondansetron, initiate cyclizine, send off a urine sample for culture and sensitivities, or initiate domperidone. Okay, so we've had one answer for B. Thank you, Fatima. That's great. What about everyone else? What do you think? Have a read yourself. It's quite a long scenario, this one, so this can sometimes happen. This is where you'll understand the importance of time management. You've got to be reasonably quick at reading these, but obviously also making sure you don't miss any of the key bits of information in the scenario. So I'll give you a little bit more time, and then hopefully you can drop your answers in the chat box. Okay, so one answer for E. Thank you, Vijatine. Any other suggestions? Please have a go. We seem to be being split between ondansetron and domperidone at the moment, so antiemetics. Okay, and somebody has also said advise assessment in early pregnancy unit. Okay, thank you. Thanks for participating, guys. Right, so let's break this question down. This is actually, when I was looking at this question, it's actually quite, obviously the scenario is very detailed. There's lots of information there. So that thing we mentioned about not getting distracted by the irrelevant information is important, but picking out the key points is really important. There's actually a complicated, multi-layered question. There's lots of information. And what you actually have to do in this question is you have to recognize the problem. So what is the patient suffering from? Assess the status of the patient, whether whether she's acutely unwell, dehydrated, or whether she's actually perfectly fine, and then know what is advisable in this particular scenario according to the guidelines. So it's actually 3 steps that you have to do. That's quite challenging, quite a difficult question. So let's just highlight the key points. Her age isn't really important. She's 10 weeks pregnant, so she's first trimester. Whether it's the first baby or not, okay, that could be relevant, but it's not crucial. She's at first trimester. She's struggling with nausea and vomiting, okay, for a week. The fact she's tried ginger, small bland meals, and drinking fluids little and often, it doesn't actually change the answer that if you look at the options, doesn't actually change materially what her actual status is. She's finding it hard to tolerate full meals, but she's snacking during the day, so she is keeping food down, okay? She's passing urine well, all right? The fact that she hasn't been able to work, that's not really relevant. You can ignore that. She's got no abdominal pain, no dysuria, and no fever. There are 3 key bits of information there. She's keen to try some medication. Past medical history is unremarkable. Obs are normal. That's key. Urine dip is clear. Okay, so no nitrites, no ketones. Okay, so the first step that you have to decide is, because the scenario could suggest hyperemesis of pregnancy, or it could suggest UTI, depending on which way you look at it. But a lot of the information is actually pointing you away from UTI. So it's, because it's saying her urine dip is clear, she hasn't got any urine symptoms, etc., etc. So you can rule out D straight away. So you don't need to send a urine sample off for culture. I mean, you might do, in a real world scenario, if she had some slightly different symptoms, but in this particular one, you can ignore it. And then you're left with, the next one to look at is, does she need assessment in the early pregnancy unit? So she's suffered from symptoms for about a week, okay? Her obs are stable, so there's no concerns about hemodynamic instability. There's no concerns about dehydration. She's passing urine normally. She's actually keeping, it looks like she's keeping fluid and food down, but she's not tolerating full meals. That's quite a clear picture of, mild hyperemesis. And the other key bit is that in the urine dipstick, there were no ketones. Obviously, if she was dehydrated, ketones would be present, and therefore you would definitely need to get her assessed in the early pregnancy unit. As that isn't there, you can put that to the side as well. So A and D are ruled out. Now we have to look at between B, C, and E. Now in this bit, there's no other way apart from knowing what the guidelines are. So you see what we're saying about everything comes together in this one question. You need exam technique. You need to pick out the key bits of information. You need to ignore the relevant ones. You need to do it fairly quickly within a minute. And you need to know the UK guidelines as well. And the UK guidelines suggest that in hyperemesis, when you're managing in the community, it's actually the correct answer, sorry, which we didn't even get to yet, which I'll show you on the next screen. Correct answer is C, cyclazine. According to the guidelines, cyclazine is first line and domperidone is second line. So that's why cyclazine is correct. And as we said, hyperemesis, no signs of dehydration, tolerating food and fluids, no concerns, no ketonuria. You have to decide which antiemetic to give her. All right, so a complicated, multi-layered question, which shows really well, actually, how everything needs to come together for you to answer that correctly. So don't worry, guys. As I said, it's all about having a go here, picking up the learning points here to make sure you then don't make the same mistakes later in the examination. Can I just check with Dr. Shkil or anybody else? Have we got time to tackle one more quickly, or should we pause here? I think if we can do it quickly, we should hopefully still have time. Just give me an indication.
Yeah,
Okay,
could do one more
thank you.
question.
Great,
Yeah.
Great. Thank you. Thank you. All right, let me have a look. Which one shall we do next? Okay. Right, let's have a look at a community type one. Okay, yeah, we've looked at kind of hospital ones. Now let's look at more of a community-based one. So 6-year-old boy presents with a 3-day history of a runny nose and right-sided earache, which started 24 hours ago. On examination, his temperature is 38.3, his respiratory rate is 18, his pulse is 92, and his oxygen saturations are 98%. His left ear appears normal, but the right tympanic membrane is red and inflamed. The ear canal and external ear are normal and there is no discharge. He has no other medical conditions. What is the most appropriate management option? So the options are oral coamoxiclav for 5 days, neomycin and dexamethasone ear drops for 7 days, oral amoxicillin for 5 days, analgesia and worsening symptom advice, or arrange admission to the pediatric assessment unit. So this could be a scenario of where you are working as an FY2 in general practice. You could be an FY2 in A&E. You could see this person in both scenarios. And so it's asking you to decide what is the next most appropriate management in this scenario. So take a little bit of time to have a reread, if you need. Drop your answers in the chat box. We'll work our way through this question, highlight some teaching points, and then we will come to summarize the webinar for today. Obviously, as well, this is a pediatrics question. You're going to get a range of specialties. All specialties will be covered in PLAB1, as you are expected to have a good basic knowledge of all of them as an SHO or an FY2 in the UK. So it's important to be familiar with them, even if you don't have much experience of it practically. Okay, so Fatma is saying arrange admission to the pediatric assessment unit. Thanks, Fatma. Anybody else? Afijathine is saying oral coamoxiclav for 5 days. So oral antibiotics. Huda is also saying oral antibiotics, coamoxiclav. Anybody else? Okay, I think that's probably everyone who's tended to participate so far. Right, okay, let's break down the question. I'll try to be as concise as I can. Again, this is another question where you have to marry the key bits of information with your knowledge of the guidelines. If you don't pick up key bits of information or you don't know the guidelines, you'll get this question wrong. Or if you're just guessing, you'll have a 20% chance of getting it right because you're picking 1 out of 5. So here what you have to decide is you have to decide, number one, does this patient need hospital assessment? That's the first question. So you've got a 6-year-old boy, 3-day history of kind of upper respiratory tract infection symptoms, runny nose, viral upper respiratory tract, then right-sided earache, which only started 24 hours ago. That is a key bit of information. Other parts that are important on examination, temperature is 38.3. So he's got a mild pyrexia. Respiratory rate is fine. His pulse is fine, and his oxygen saturations are fine. So the only observation that is abnormal is his temperature. Okay, so viral upper respiratory tract infection history, 24-hour history of ear pain, and a mild fever. Does that suggest that this is a patient who needs assessment to a hospital? I would say no. And so you can say that arranging admission to the pediatric assessment unit, you can rule that out straight away. Now, then what you have to decide is between the remaining 4. Now, other key bits of information are obviously left ear, which is no symptoms, is normal. Right tympanic membrane is red and inflamed, but there's no discharge. Okay, here what you have to do next is you have to decide, okay, so this patient is obviously looks like is developing otitis media or has developed otitis media, but has only had the symptoms for 24 hours. What the guidelines say is that the need for antibiotics are only met if there are symptoms of the otitis media for longer than 3 days. So you could easily get confused here because you could think he's got a 3-day history. But if you reread the question properly, 3-day history of a runny nose, but the earache is only 24 hours. So he hasn't got ear symptoms for 3 days or more. He hasn't got discharge. He hasn't got otorrhea. That is one of the other indications for antibiotics. And he is not under 2 with bilateral otitis media. These are the NICE CKS guidelines on when antibiotics should be given for otitis media in children, because as we know, the vast majority of them are viral. So far, based on what the scenario is saying, it's, he might end up being bacterial otitis media, but currently it's presenting a summary of viral otitis media. So actually, the need for antibiotics is not met. So you can actually say oral Comaxiclav, even the eardrops, because they are not, they're not indicated, and the oral amoxicillin are not needed. The only correct answer, according to the information in the scenario, is analgesia and worsening symptom advice. And that's because, just to clarify again, is presenting as a viral otitis media. It doesn't meet the criteria for antibiotics. Obviously, if there was perhaps there was a bit of a different scenario, like he had discharge. Okay, if he had discharge, criteria for antibiotics is met. If he had symptoms of the ear pain for longer than, for the same amount of time, let's say that he had a runny nose, so he came with a 3-day history of earache, then the criteria for antibiotics are met. And obviously, if he had any other, or he was under 2 and he had bilateral otitis media, that's the other thing. So they're not met, and so reassurance and analgesia advice is the correct answer for this one. In terms of admission, as we've already mentioned, he's not unwell enough, really. There are some specific guidelines for that, but I won't go into them in detail here. And so again, this is a good example of picking out the key bits of information from the scenario, but also knowing the guidelines, knowing what UK practice is, and being able to marry the 2 of them together to help you arrive at the correct answer. Okay, I think we will stop there now, because we've hit 12 o'clock, and what I'm going to do is I'm just going to very briefly give a summary of what we've done, and then I'm going to hand over to either Ziam or Akidat, I don't know which one it is, who are going to, it's Akidat, I think, who's going to supervise the Q&A session if there are any. So just to summarize, PLAB1 success requires a few things. It requires relevant, up-to-date knowledge. The relevant bit is really important. Focused, beneficial practice. The two of them to work together in that you practice, then you analyze your weak areas, you go back, you work on them, and then you practice some more. And the final thing is you need good exam technique, as we've identified with just these few questions, that, you know, exam technique is absolutely crucial to being successful in this exam. Obviously, Hive is here to help. Don't forget, you do have access, the ability to access 5,000 MCQs to get an idea of our resources if you want to take that up. We're here to help you with the exam preparation, and as Akid had mentioned earlier, you know, with every part of your journey. Future webinars will focus more on that, and we'll rotate between the two. But for now, that's all from me. So I'm gonna hand over to Akidat now, just to kind of see if there are any questions or see if anything was asked in the chat box. And then if not, then we'll close. Thank you everyone for your time and for attending. I'll hand over to Akidat now.
Thank you so much, Dr. Umar. It was such an interesting webinar. And I must say that we are very thankful to you that you have given your insight, invaluable insights. I'm so much thankful to you. So thank you so much once again. So now I would like to ask every one of you, like Dr. Umar have briefed us about everything. If you guys have got any question regarding anything, you guys can just put your question down in the chat box below. And if not, if you want to talk to us directly, you can just like unmute. We can unmute your you and you can ask your questions. So the person who just wrote that he is from India, Happy Juteen N, like, have you got any questions? And I feel like you are very happy. I think you have been very interactive during the session as well. And it's okay to ask questions. Okay. And if you really want to like approach hivemedicalacademy.com for your further anything you want to do regarding PLAB, or you want to be practicing medicine in UK or anything, you got any question, you can just directly send your message to hivemedicalacademy.com as well. So anyone else who have got any question could just write it down in the chat box below. So no questions? Okay, it's fine, no issues. But let me again tell you one thing, that before ending this webinar, I just want every one of you to know that there was this one package that I came across in the Hive Medical Academy. That included 24/7 access to the tutors, living teaching sessions, video and audio courses, and everything else. So like they have got different packages for you guys in which you can access tutors and live teaching sessions and everything else. So if you guys really want to avail, and like Dr. Umar, you guys just met Dr. Umar, and like Dr. Umar, there are tutors who are teaching you about exams and everything else. So if you want to like avail any package, you can contact Hive Medical Academy. So like there is this says now that there's a big beautiful code, where there's a will, there is a way. So if you guys have got will to practice medicine, you guys can. So thank you so much, Dr. Umar. Thank you so much, Dr. Shakil Malik. And thank you everyone, Hive team. And thank you so much audience for attending this webinar. And we are so grateful to you all that you have been the part of the webinar. Thank you so much.
Thank you, Akidat. Thank you, everyone. Thanks for